I'm Dr. Dooley and I'm a board certified psychiatrist, and I want to talk a little bit today about the intersection of psychiatry and the law as it relates to a response to a mental health crisis. So when an individual is displaying signs of a mental health crisis or issue, it's not uncommon for their friend or family member, neighbor, or even just a concerned citizen who may be observing behavior that is concerning to call 911. And when they call 911, sometimes depending on what is reported, that will determine whether it is a law enforcement, a police response, or EMS who responds to the report. Depending on where you're located, it might automatically generate a response from the police. And please know that if you are a individual who has contacted like 911 or even the police when you were concerned about a friend or a family member or someone having a mental health issue, that I'm not placing like any judgment or saying that you shouldn't have done that. But what I do want to communicate is that it's important for all of us to understand that when we reach out and we call the police, we are going to get a police response. So like they say, they're law enforcement officers. They're there to enforce the law. Many police officers have very limited, if any, training involving responding to mental health crises, to de-escalation, like verbal de-escalation techniques, or even physically how to restrain someone with the intention of not injuring them. So on mental health, acute inpatient mental health units, it's not uncommon to deal with or manage individuals who have combative or disruptive behavior, but we receive special training, often yearly, if not more frequently, in how to, first of all, try to de-escalate those behaviors. We go to seclusion, oftentimes if not that, or like try to use a chemical restraint like an oral medication, and then only moving on to like physically restraining someone or using an injectable medication as a last resort. Just also because of professional standards regarding, your mental health provider and the patient, or even sometimes like legal issues. If we need like a welfare or a safety check, then law enforcement are the people who are engaged with that. Even if it's not a mental health crisis, if we're calling for a welfare check, law enforcement are the people who are doing that. So when I was in direct patient care, caring for patients, I'm only gonna reach out to law enforcement in situations where I think that a person might have a weapon that they might use to hurt themselves or others, and it needs to be secured. I'm seeing a lot of risk factors in their body language or verbally that I think the situation is a high risk for violence, or the person has they have those risk factors, like I'm seeing them actively, and I know that they have a past history of perpetrating violence, because the number one predictor of a person who's gonna enact violence in the future is someone who has acted out violence in the past. Even me acknowledging situations where there's a high risk for violence, where I may need backup support from the police, when they respond as a mental health provider, if at all possible, I'm gonna be the person who's maintaining, like the active person who is working to resolve the situation, to move that patient to the next level of care they need, whether that's the emergency room or get into inpatient facility. This is still all with the understanding that I know once police show up, just their physical presence, sometimes that's going to, de-escalate or kind of decrease the situation. And sometimes it's gonna increase the situation, because once people see that, they might, again, be scared or nervous. Maybe they've had bad interactions with the police in the past. So even if I'm still the primary person who is managing the disruptive situation, just the physical police presence can make things better or worse. But there are some alternatives to the traditional mental health system when there's a crisis. So I'm going to share some resources that we have in the state of Georgia, just to give you an idea, if you're in Georgia, that they're available, but also in your state, in your county, to check to see if you have similar resources when a person might be in a crisis, a different way of trying to get them help other than calling like 911. So in Georgia, we have the Georgia Crisis and Access Line. It's called GCAL for short, and here is the number. So if an individual is experiencing a mental health crisis, you can contact this number. So they have a 24/7 call center, and here I try to include the part where they talk about some other type of interventions that they may be able to help with. Maybe it's, finding detox beds, maybe it's getting, access to a sooner appointment, letting the person know where the nearest crisis center is, particularly if a person is willing to go with you to get assistance. This could be a viable option as opposed to calling 911. So you often hear us talk about calling 988. That's the National Suicide Prevention Hotline. But sometimes a person is nervous to call that number, or maybe they are in a crisis, or they just need additional support, but they aren't necessarily having like imminent thoughts of self-harm. It's a peer-to-peer warm line. So a peer support specialist is an individual who has a personal history of a mental health or substance use disorder or both, and they've received special training to help support other people who have those issues. And so that is who mans this line. And I know that some people, that's why it's called a warm line instead of a hotline. So you don't have to necessarily be in like a very high acute crisis. Maybe you just need additional support. So this is also an option. These locations, again, this is in Georgia, they actually have respite beds. So those are beds within this physical location that an individual can go. Maybe if they are feeling unsafe and they just want to be out of their house, maybe there's some social stressors that are worsening their mental health at home, and they really need to physically be away from that situation, but they don't either want or maybe necessarily don't even meet the criteria to be in an inpatient psychiatric hospital, but they know that they are not like safe, or their mental health is struggling in the location where they physically are. Again, there are a few respite rooms, beds, like where people can actually go and stay at these centers. I know one of these, if you're in the Atlanta metro area, it's in Decatur, near the Avondale MARTA station, just for kind of reference of where that one is located. And I came back here also to add that sometimes the person's mental health condition may cause them to like repeatedly contact 911 or the police because they believe that someone is physically harming them, breaking into their house, stealing their things. They might develop like delusional thinking. I see this also with patients who have dementia, where they develop these delusions, but also just other psychotic thought disorders where they believe this, and so they continually call the police, and instead of maybe recognition that there is a mental health issue, why the people are contacting the police in the first place, they can even be charged. I've seen patients charged, there's a charge you can get for like calling 911 like inappropriately or like frivolously. So I've seen that happen instead of recognition that, okay, if the police have responded to the house for a break-in 10, 15 times and there's no sign of a break-in, that there may be something mental health going on, as opposed to just a person who wants to like misuse 911. Again, I know in our country, mental health is underserved. There's not a lot of resources for dealing with a crisis in mental health. So I did want to come to provide some alternatives, and you can look in your area to see if you have something similar, like warm lines, like respite beds, any alternative to traditional mental health, when that may be a viable option to contacting the police or 911 directly.